Good morning. We are so glad to have you join us for today's live webinar series that's hosted by the Mayo Clinic Cancer Education Program on Mayo Clinic Connect. I'm Janine Kokel. I'm a patient educator with the Mayo Clinic Cancer Education Program in Rochester, Minnesota. I will be moderating this session today. My colleague, Angie Murad, will be assisting today with technical support and assistance for managing questions at the end of today's session. If you have questions that pop up throughout the topic today in the session, please just type them into the chat function at the bottom of your Zoom screen, and then we will address those at the end of the presentation. We want people to know this webinar that this session is being recorded, so individuals who are not able to join us for the live session can watch it later. For those of you who would really like to view this again at a later date, the recording takes about 3 days to be edited and then put onto our video library tab on the cancer education page on that Mayo Clinic Connect. As many of you know, Mayo Clinic Connect is a digital platform where patients, family members, and caregivers can connect, get evidence-based information, and really get access to information about programs, classes, oncology education needs. We encourage you to follow the cancer education blog on Mayo Clinic Connect so you can stay up to date on upcoming webinars and other educational opportunities. We will put the link to that Mayo Clinic Connect for our education blog in the chat function. This is the first presentation of a 3-week series on financial toxicity in cancer, managing the cost of cancer care. The term financial toxicity is used to describe the treatment-related financial strain that's experienced by patients with cancer going through treatment. However, we know that financial impact goes well beyond active treatment costs. This series of presentations will address the many factors that can contribute to financial toxicity, identify strategies to manage debt, tips for reducing financial burden, and outline financial resources that can be of help. Today's session is focused on managing the cost of cancer care, insurance-specific issues. Whether you have medical insurance or not, it can affect your risk for financial toxicity. Even with health insurance, the out-of-pocket costs for cancer care may still be overwhelming. So this session specifically will kind of review commonly used terms related to medical insurance coverage, describe typical reasons why maybe an insurance claim might be denied, tips for keeping your medical and insurance paperwork organized, and identify ways to help you make the most out of your insurance coverage. It's my pleasure to introduce our speakers for this webinar series. Angela Young is a licensed social worker by trade in education. She works closely as part of the multidisciplinary oncology team at Mayo Clinic in Rochester, Minnesota, in the Cancer Center. She has worked as a patient navigator for Mayo Clinic for 18 plus years. She has a wealth of experience and knowledge in working closely with patients, providing support, financial assistance, guidance, information about employment, insurance questions and concerns, and providing resources for folks on that journey. Elizabeth Matthew is a licensed clinical social worker and works closely as part of the multidisciplinary oncology team in Mayo Clinic, Arizona Cancer Center. She has been a social worker for 30 plus years and has worked at Mayo Clinic, Arizona for 27 of those years, addressing the psychosocial and emotional support needs of our patients and families, psycho-oncology program development, and financial guidance and assistance for patients. Jody Chuk is a patient navigator in Mayo Clinic, Arizona as well. She is going to join us as one of our panelists for today, but she too is a patient navigator with a wealth of experience and expertise in helping patients travel this road. Angie Young will be our lead presenter for today's session with assistance by Elizabeth, who will take that lead, the presenter role for the next week's session on employment concerns. I'm just going to share my screen briefly for a moment to share with you a resources handout that Angie and Elizabeth will be referencing during their presentations. We will be able to also put that link for that resource sheet in our chat function, and we'll have that also connected with the recorded videos from this series as well. I'll share that right now. I hope. Here we go. this is just a resource sheet so you can see the resources that we have outlined for you as helpful and will be, again, referenced during this session. All right, with that, it's my pleasure to turn it over to Angie Young for her presentation.
Thank you, Janine. I'm going to go ahead and get my screen share here. So can everybody see the PowerPoint?
Yep.
Perfect. Okay. So again, today's presentation is really going to discuss the medical insurance component. As Janine said, it is a 3-part series. Today is really just a high-level overview of medical insurance. We're not going to have the time to get into all the details and the specifics of each and every insurance question possible or questions that patients may have. It's really just to kind of give a high-level overview, kind of give a breakdown of some of the common terms and information that we really want you to have a better understanding and knowledge of. As Janine mentioned, we will take questions at the end, so please feel free to write those down along the way. Elizabeth and I will both be presenting during this PowerPoint. She will add in some additional comments along the way. So we will each present and talk at each slide. I will be doing the majority of the presenting though on the topic today. We also want to acknowledge that this is a lot of information, and please don't feel bad if you feel overwhelmed or if a lot of this is new. For many patients, it's not uncommon that this is your first large medical event where you have to really learn more about your insurance. And so this is partly why we have this series, is really to kind of help you get familiar with the terms, because many people haven't had to really look into their insurance coverage in depth and oftentimes are overwhelmed and frightened by the terminologies and the complexities of understanding medical insurance. So we will hopefully try and help lay some groundwork and then answer any questions that people might have at the end if time allows. Elizabeth, would you have anything to add for the overview before we get started?
I just wanted to add that a cancer diagnosis is often unexpected, and the cost of cancer care is also often unexpected and not planned for. So again, part of this webinar is really to provide information and, as Angie said, just a general overview. So thank you for joining us today.
Thanks, Elizabeth. So the next slide here really talks about financial toxicity. This is a term that we use a lot here in the medical facility, and we're really trying to be more cognizant of this, understanding that this is something that almost every patient experiences at some point in time during their cancer journey. There are significant economic consequences for patients that have significant medical issues, cancer being one of them. And that really can take a financial toll on a lot of people in entire family units. We understand that that financial stress can leave patients having to make some really difficult decisions. It's not uncommon for us to see patients skipping tests, not attending their appointments out of fear that they can't afford it. They may not take their medications as prescribed, or they may try to split their medications to try to space out or spread it out and make it last longer. Some patients even go so far as refusing to take treatment or recommended treatment that likely in many situations can be lead to a cure or really overall good quality of life in treating a very treatable cancer, simply because there's the fear of how am I going to pay for this and I don't have the money for this. A lot of patients experience reduced income due to needing to be away from work, or having to have their caregivers be away from work to support them during treatment. With a cancer diagnosis comes a lot of unexpected out-of-pocket expenses, things like transportation to and from the medical appointments, lodging if you need to stay overnight, if you're going for a distance for treatment, the cost of medications that you previously didn't have to take. All of these medications, all the lodging, the transportation, all of that come with added expenses that aren't necessarily covered by your medical insurance. And so oftentimes come out of the budget, the family budget or the household budget. And for many patients, their budgets were already tight. So we want to recognize that, because we need to look at the whole financial situation in order for patients to complete recommended treatment and continue with their follow-up care after they've completed treatment, and do their follow-up care and check for reoccurrences and scans and things. We need to be mindful of that financial impact all across that whole continuum of care. Elizabeth, would you add anything?
Yes. So I think just to reiterate what Angie shared, I would encourage, if you are diagnosed with cancer, please take the time to reflect throughout your cancer care. What are my costs of cancer care? What are my medical costs? What are some of my out-of-pocket costs? Are there changes in my income now, or could there be changes in my ability to work now or down the road? Assessing, do I have financial concerns that may be a barrier to care, that may delay care, or that are causing worry and distress for me right now? And if so, planning and sharing your concerns with your medical team is very important. And those are things that I think it's important to just tailor it to your situation.
Thanks, Elizabeth. So medical insurance concerns are really common. In fact, I think almost all patients have some type of medical concern, whether that's a lack of understanding or, there's some delay in getting things approved, whether it's a recommended treatment or a test. Medical insurance concerns are very, very common. I think I rarely run into a patient where everything goes perfectly smoothly. So these are really, really common things. And there's a whole team available to assist. So I think what we want patients to understand is that while we can anticipate some of these concerns and we can help, some of them we need to react when they come up, but we need patients to bring those to our attention so that we can assist along the way. Elizabeth, do you want to add anything before I move to the next slide?
No, thank you.
So some of the terminology with medical insurance can be really confusing. A lot of the terms sound similar, and yet this is oftentimes something that patients haven't had to experience before. And when the reality is when we're picking our insurance during open enrollment, we oftentimes don't read the fine detail, and we don't, get familiar with a lot of these terms. Certainly, a lot of this is discussed in open enrollment information if you read the fine thetail, but many people don't, and that's really common. So just to briefly review the common health insurance vocabulary that Elizabeth and I all feel are really important for patients to understand at the very minimum, would be the monthly premium for your insurance is that's what it costs for you to have insurance. Our goal is that everybody is insured. And so with that comes usually a monthly premium for most people. And so that monthly premium is what it costs you to have insurance. Then there are costs that there are costs associated with using the insurance, and that is the longer list on the screen here. So things like the annual deductible. Your annual deductible is the amount that you as a patient are responsible for, and you must pay that before your health insurance will start to pay anything. So that is patient responsibility. So when you sign up for an insurance plan, if there's a deductible, you can expect that you need to pay that out of pocket before your insurance is going to cover any type of medical expenses. Your co-payment is a set dollar amount that you pay each time you have a covered service, such as a doctor visit, or maybe there's co-pays related to picking up a prescription at the pharmacy. But your co-payment is a set dollar amount. That's also usually discussed or reviewed in your open enrollment packet when you select insurances. Your co-insurance is the percentage of the total cost of the service that you pay. So many times insurances are like an 80-20, which means your insurance covers 80% of the cost. And as a patient or as the insured member, you cover 20%. So that co-payment is that percent that you need to cover. Your out-of-pocket maximum, that is the total out-of-pocket dollar amount that you would need to pay in the year for your insurance. So that dollar amount can vary for each patient. Sometimes it's $2,000, sometimes it's $5,000, sometimes it's $10,000. But once you hit that out-of-pocket maximum, most times your insurance company will cover things at 100%. Some other common terms that we felt were really important for patients to understand, and there are some acronyms, and if there are acronyms, we will use those. So explanation of benefits, or EOBs, those are the actual statements that you'll receive from your insurance company that says of the tests that were sent, or the charges that were sent to your insurance company to be reviewed for coverage, this is what we covered. So your EOB will tell you what your insurance company covered and what is patient responsibility. If there's a dollar amount that's left from your insurance that your insurance didn't cover, that goes back to the medical facility that billed you, or that billed the insurance company, and you will have a patient responsibility. You will owe the medical facility money. The in-network versus out-of-network is really important to understand. Your insurance plans have in-network and out-of-network facilities. Ideally, you should be at a facility where you have in-network coverage, because you will have the best coverage. If you are at an out-of-network facility, your insurance coverage will be less. So as much as possible, make sure you're looking into who is considered in-network, who are your providers in-network, so that you are getting the best and most optimal insurance coverage. Monthly statements are statements that will come from the medical facility that will tell you these are all the charges that were sent to your insurance company. It will also tell you whether or not there'll be bills. They'll tell you if there's a patient responsibility that you owe the medical facility money. Open enrollment is a time where you can choose your insurance plans. Oftentimes that's in the fall for many employment places of employment where your insurance renews on January 1st. So typically in the fall, and for many of our Medicare patients, they have open enrollment late fall, and then that insurance becomes active January 1. Occasionally there are contractual agreements where open enrollment happens outside of the fall But just contact your human resources department if you have any questions about when that open enrollment is through your employment. Prior authorization is where we send a request to the insurance company to determine whether or not the insurance is going to cover the requested service. It is not a guarantee of payment. It's just, will you cover this? Would you consider covering this service? Medical necessity is a decision regarding a service and whether or not it's justified or is considered reasonable or medically appropriate based on clinical standards. And insurance companies can differ on this. So medical necessity is something that we oftentimes will need to speak to here in the medical world. COBRA is an option where you can pay your entire insurance premium to keep your employer insurance after the loss of a job or when transitioning to long-term disability. Elizabeth, would you add anything?
Yes, I'm going to focus just again very quickly on the cost to use insurance. And I would encourage all patients to be aware of each of those areas. What is my annual deductible? What are my co-pays or co-insurances? And what is my out-of-pocket maximum? Oftentimes, as you're receiving bills or you're getting, this is your responsibility, noting your out-of-pocket maximum. Oftentimes, if it's $2,500 less or greater, then you know that after that time, if you're in an in-network facility, that you could be getting 100% coverage. So stress can be reduced if we know this information. So I would encourage everyone to be aware of this information as well as keep track of the information. And ways of getting that information is by reviewing your benefits either through your employer or contacting your insurance directly and going over these questions with them. So that would be something I would encourage. And then we touched on the common terms. And the only thing I would add is staying in network significantly reduces cost of care. So seeking a provider out of network is a high cost area and oftentimes a major financial stressor for patients. So if possible, I would encourage patients to consider to stay in network.
Good points, Elizabeth. Thank you. So the next slide here just really discusses the fact that we oftentimes have denials with cancer care services. Again, I think what we want, both Elizabeth and I want to stress, is that these are really common. And there's a lot of reasons why we get denials, and we just very high level listed some of the more common denials that we see here in the medical center, specifically the cancer center, just really to more normalize and have patients understand and stress that this is very common, and we're very aware of this, and as are your healthcare teams. And so we're here to assist when these denials come up. But just real briefly, just to kind of review, some of the denials are related to the fact that prior authorization was not obtained. If that ever happens, we can go back and do a retro prior authorization. But as much as we can, when possible, we want to make sure we are seeking prior authorization. Sometimes we receive denials because we're considered out of network. Again, as Elizabeth mentioned, being in network gives you the best coverage for care, the least amount of out-of-pocket expenses. Sometimes the care is unique enough that you do need to be seen at a facility that is considered out of network. And if that's the case, we can appeal for in-network coverage, but that is something your healthcare team would assist with. Sometimes the denials are considered non-covered services. investigational, experimental, and sometimes they'll determine that it's deemed not medically necessary. If your care team feels very strongly, we will handle the denials and we will assist along the way, or it may just change what the providers feel would be the next best step. But we will be there along the way if there were any denials that come up. What things patients can do or caregivers that can try and do is always call your insurance company to ask if Mayo Clinic is in network. Just hear that from them, double check, cross that off your list. Notify your doctors and your team immediately if there's any denials that come up. Sometimes advocating with your employer, your human resources department, and letting them know that you are having issues with the insurance coverage provided through your employer. Sometimes they can advocate on your behalf and try and assist in getting the services, treatment, test covered. They are the ones that do every year research what options they offer you as an employee. And so if they're finding there's a lot of issues with coverage and the insurance policy that they chose is not covering their employees as they hoped, they may choose differently the next year. So it's always a good idea to make your employer aware of these issues as well. The other thing you can try to do is request a case manager with the insurance company. The nice thing about getting a case manager is that you have one point person within the insurance company that you can contact with any questions that come up. If there's a denial, that one person can help you along the way. That one person can also be a key contact for us on the healthcare side of things, or your care team when we need to make calls in and ask for further questions or assist with a denial. Not every patient can get a case manager, but oftentimes when requested, that request is honored and you will receive a case manager upon request. The other thing I would like to stress is that when you make calls to your insurance company, please, please, please document those calls. Write down the day you called, the time you called, who you spoke with. Keep notes. Because that will be helpful in the event we ever need to have that documentation or paper trail to assist us along the way. Elizabeth, would you add anything else?
I would just add that generally the insurance will send you correspondence in the mail to let you know if there is a denial and steps that need to be taken for an appeal process. So that is something you should be receiving, and information on how to address that denial or appeal the denial. We do have workflows in place. If somebody's getting chemotherapy or needing some tests where prior authorization is a part of that workflow. But again, it is good to call your insurance just to make sure, are there prior authorizations that I should be informing my teams about. And then requesting a case manager, Angie provided really a good overview on that. I think it's helpful when you get assigned a case manager to talk to that person and just review her role. As a case manager, oftentimes the case managers may have different roles, and is understanding what that insurance case manager's role is and how she or he can help you navigate the care can be important.
Great point. Thank you. So the next slide here just really talks more about making the most of your health insurance. So what's really, really important is that patients remain insured and that we don't let an insurance lapse. So what that means is you always have to stay current in paying your premium. You may remember at the beginning of the presentation, your responsibility to have insurance is that you pay your monthly premium. That's the cost to be insured. Oftentimes, patients, if they carry the policy through an employer, have that premium deducted from their paycheck. It's not uncommon when patients start in treatment, they may have a decrease in hours worked, and they may not have enough in their paycheck to cover their monthly insurance premium. So please keep in mind that that is withdrawn automatically from your paycheck, and you should be reaching out to your employer to ask what types of arrangements you need to set up so that you can pay the insurance premium, or sometimes the employer might defer the payment and will just pull it from paychecks when you get back to work and you start coming back and you have a paycheck. They'll just garner more out of the paycheck when you're back. But you need to have those conversations with your employer. In the event you're not able to pay your insurance premium, please, please, please let someone on your healthcare team know, because there could be programs available. We want to explore resources to make sure there's not something we can do to assist and helping to cover those insurance plans. Oftentimes we can cover those a little bit easier than actually covering the cost of entire care when you become uninsured. Make sure you're using in-network providers. As Elizabeth said, in-network gives you the best coverage. And then, as we mentioned, proactively reaching out to the insurance company just to verify if prior authorization is needed. Remember, it's not a guarantee of payment. It's just to confirm that it meets medical necessity. And then if there's any questions, follow up with your care team or the patient account services at Mayo Clinic, as we're all able to and willing to help troubleshoot any questions that you might have along the way. It's not uncommon for these to come up along your cancer journey. So 2 and 3 months down the road, sometimes these things will pop up. So please reach out to the team at any time. Elizabeth, do you have anything to add?
So the only thing that I would add is please notify patient accounts if there is a change in insurance coverage at any point, just so that the insurance is sending the bills to the correct insurance. That can definitely be very important and decrease a lot of confusion that can happen if they're sending the bills to the wrong insurance. So oftentimes if there's a change in the middle of care, maybe you change to your spouse's insurance. And every year when you are getting a new insurance card, I would definitely update that with our patient accounts team.
Great point, Elizabeth. Very important. So knowing that all of this comes with a lot of paper, if you've elected to have your insurance paperwork sent to you via mail, you're going to get a lot of papers. If you have elected to, or you're signed up for electronic billing or electronic explanation of benefits through your insurance, you may find it will come to you electronically via a portal. But remember that keeping organized will make your life a lot easier along the way. Pay attention to your bills. If something doesn't look right or something looks off, ask questions, bring it to our attention right away. It's easier for us to deal with things right away in the moment than letting them go 2 and 3 and 4 months. We have more resources and we have more options available to us the sooner we're made aware of the situation. Keep copies of all of your paperwork. That's any medical letters that are sent in for any denials, any explanation of benefits, any bills, receipts, FMLA paperwork that gets sent in to your employers. Keep copies of all of that. The receipts are especially important if you have a flex spending account or a health savings account. You're going to need those receipts to submit those requests for reimbursement. So make sure to kind of find a process that works for you. It might be a file folder. If it's electronically, it might just be writing down your username and passwords in one location so that you can easily get into both portals, your Mayo Clinic portal, your insurance portal. Just try your best to keep things organized and in one location. Elizabeth, do you want to add anything to that?
So I think managing the cost of care or staying organized, just as I work with patients, I know oftentimes they'll share with me that this can be a very stressful time. Just because of the care, maybe there's a lot of bills that are coming in and a lot that needs to be managed during cancer care. So if you would benefit from just help, I know there are family members who are more than willing to support you or may have shared that they want to support you in some way. So again, just as I work with patients, oftentimes this is an area that a family member or a trusted friend may be helpful to just help manage the organization part of the care. I would say it's good to still stay engaged and know what's going on and have communication with that person. But it really may allow you to stay focused on your health and your care. And this may be an area that you want to share with a loved one to assist with.
That's a good point, because it's helpful to offload some of that responsibility. Oftentimes caregivers and friends are looking for ways to help, so that's a nice way to allow them to assist. So real quickly, just an overview, because again, these phone numbers will be on that resource sheet that Janine mentioned at the start of the presentation. But again, we want to stress, you need to let the care teams know early if there's any concerns with paying for bills, medications, household expenses. If you anticipate a potential loss of job, loss of income, loss of insurance, we need to know. Don't assume we're going to find out from someone else. We would like to hear it from you, and as soon as you can share that information with us. Your care team consists of your medical providers, the business office, financial counselors here at Mayo Clinic, your social work team, patient navigator team, as well as patient account services. And again, these phone numbers will be on that resource sheet. These are the resources, the websites that were listed on the resource sheet. And so really what Elizabeth and I just want to share here is that we provided a high level overview of some information. Again, we didn't get into a lot of the details, but a lot more specifics and a lot more information can be found on any of these websites. And we oftentimes will utilize these when working with patients that have additional questions. Elizabeth, do you want to add anything about the resources?
No, I think all of these are good resources and commonly used resources. And the only thing I would add is, again, financial stress is common, but you are not alone, and you do have a team who is available to help and support to address and navigate your concerns.
Right, wonderful. I'm just going to jump in and say thank you. That was an excellent presentation, and you did a great job of taking content that's sometimes difficult to understand for most of us that aren't living in that sort of financial-ish world. And you did a nice job of bringing that down to an understandable perspective. So we welcome questions on the chat. So if we could please have you type your questions in. We'll take those. There's a question. How can we get a copy of that page of resources you showed? So actually right above your question, we did put the link for that resource right on Mayo Connect. It's out there now. You can click on that link and it'll take you right to that. Let's see, it will also be connected to when we get these recorded videos back. about 2-3 days. That'll be attached to the same area in the video library where you can find these presentations. We'll have a copy of that resource sheet as well. Sometimes it's hard to even know what your questions are, I think, as a patient going through this. And sometimes it takes some time before you start to realize what your questions are. And I thought you did a nice job of outlining that. And for like myself, I'm not very good at financial planning. And so I liked your comment about, maybe calling on a trusted friend or a relative or somebody you know is able to help in those situations. I know, especially for folks when they're going through treatment, you're often fatigued and not always feeling the best, trying to work and have a lot of other stressors as well. So I thought that was really great. Any other comments that you all had that you wanted to share further? Kind of a quiet group here. I kind of suspected we were going to get a lot of questions, but maybe people are still formulating those.
This is Angie Murad, another patient educator. I just had a question. So some of these resources, I mean, obviously you're more familiar with Mayo Clinic, but like, are there similar type things that if claims are being denied, would it be a similar situation where they is there someone that's kind of standard that someone would talk to in a different organization if a claim was denied or something like that?
I think it's always helpful to start with your medical team, and they can refer you to the appropriate team members, whether it's at Mayo Clinic or whichever facility you may be receiving care. And then that team member can really tailor to a specific resource if that is necessary. All of the resources that we're sharing really provide good information, advocacy, and support of the topic that we have discussed today.
That's a good point, Elizabeth. Thinking through that, I wouldn't automatically think to talk to my care team. I think I would talk about my treatment, but insurance is such a big part of that and coverage of your treatment. So it's important to have that conversation with your care team. Thank you.
Yeah, absolutely is. I agree completely. Well, let's see. Is there any other questions from any of our panelists or our attendees for today? If you have questions that come up, you type them here, or you can actually reach out to us on Mayo Clinic Connect if you have further questions, and we can get those questions answered by our speakers and have them also posted on our Mayo Clinic Connect page where this recording will be posted. All right, I think that's probably it for today, but I appreciate your time and your expertise and sharing that information with all of us. Thank you.